Hello, and welcome to another live broadcast with MedStar Health. My name is Karen Zingle, and I'm joined today by breast surgeon, Dr. Jennifer Sun, and plastic and reconstructive surgeon, Dr. Robert Howard. As many of you know, October is Breast Cancer Awareness Month. So we're taking this time to discuss the importance of early detection, specifically with a mammogram, and the latest advances in breast surgery and breast reconstructive surgery. Did you also know that mammography can help reduce breast cancer by 40%? It's in fact the only test shown to reduce breast cancer deaths. So it's very important to get your yearly checkup. And actually, National Mammography Day is this Friday, October 15th. So now is the perfect time to schedule your yearly mammogram. So please stick around, give us a like, let us know that you're watching. Tag a friend or family member who might need a reminder about their mammogram, and ask your questions in the comments below. We have lots of questions to get through, and we'll answer your questions as well. So please include yourselves, include your family members, and tell us a little bit about yourselves in the comments. Before we get started with the questions, thank you both for joining us today. Let's start with Dr. Sun. Can you introduce yourself to our viewers?
Yes, hi, my name is Jennifer Sun. I am one of the breast surgeons here at MedStar Montgomery, and I work closely with Dr. Robert Howard, who's also here on the live stream. We work together for all of our breast cancer patients and diagnoses, and we work together to make sure we give you the best oncologic outcome and the best cosmetic outcome as well.
Thank you very much. Dr. Howard, can you introduce yourself?
Hi, Karen. Sure, and hello to everybody out there on Facebook. Name is Rob Howard. I'm a board certified plastic surgeon, and I specialize in breast cancer reconstruction and microsurgery. Like Dr. Sun said, we work together. I grew up not far from here in Anne Arundel County. I went to the Naval Academy. I feel really fortunate to have trained at Emory, where I learned from great innovators in the field. I served for a while a long while in the Navy, where I did both breast cancer reconstruction and complex microsurgical care of our wounded warriors. I've been at MedStar now for a year, and I feel, just a great opportunity to be a member of such a great team with great resources to bring the best cutting edge care in cancer to our patients.
Thank you very much. Thank you both for the time. Let's get into some questions. Let's start with you, Dr. Sun. We want to get some background just about mammograms in general. Can you talk about what they are and why they're so important?
Yes, absolutely. So a mammogram is a process of using low energy x-rays to examine the human breast. For diagnosis and screening, they're so important because they can identify abnormalities even before they become clinically visible to the naked eye or to the touch.
Mm-hmm. And how does it work?
So screening mammography usually involves 2 views of each breast. It involves low x-ray beams that can portray this picture. It usually takes about 10 minutes to complete, and then the 2 views are reconstructed to create a 3D image.
Thank you. Can you talk about the smart curve technology?
Yeah, the smart curve technology we have here at MedStar Montgomery, it provides a high resolution mammogram. The paddle of the curve is slightly curved to mimic the patient's breast, and it distributes pressure more evenly and decreases discomfort. Therefore, there is no pain involved.
Thank you. And who should be getting a mammogram and how often?
Yeah, so for average risk women, the guidelines say to start at the age of 40 and to screen every year. Average risk means that you don't have a family history of breast cancer. However, if a patient is considered high risk, that is a mother, a sister, or a daughter with breast cancer, then we start to screen you much earlier, and you should talk to your provider to discuss these guidelines.
Okay, thank you. How accurate are the results? Is there ever a time where you could get a false positive?
Sure, as with any exam, there are some false positives. The rate of false positivity for a mammogram is about 10 to 12%, and that usually happens with younger aged women, but we always err on the side of caution, and we ask you to come back to get extra imaging to make sure that we are giving you the best care.
That makes sense. Thank you. How does breast density impact the results of your test?
Yeah, so breast density means that you have a lot of breast tissue, and it's sort of like a foggy picture. Usually younger women have high breast density, which is why we don't recommend starting mammograms until the age of 40, unless you feel something, of course. And so that sometimes creates an increased risk of false positivity, but we limit that by allowing you to screen at the age of 40.
Mhm. Okay, thank you. Now, what happens if someone receives a positive result or a lump or a tumor is detected? What happens next?
Yeah, so if a lump is detected, like you feel it clinically, you are always asked to get mammography next. After a mammogram, you are asked to get a biopsy, and that's done with a small needle. And not every mass that you feel is breast cancer. So please don't be afraid to get screening because of this. Once we get a diagnosis, then we discuss the next steps. Sometimes there are benign and normal reasons why you have a palpable breast mass, but a lot of times it's not cancer. So don't be afraid to seek care.
Mhm. Thank you. So if you are diagnosed with breast cancer, what are some of your surgical options?
So if this turns out to be breast cancer, then you are referred to a breast surgeon. And at that point, there are so many different options that we can do. But in general, we do something called lumpectomy, which is also known as breast conservation therapy, which means we just remove the breast cancer and I leave the rest of the breast intact. The other option is a mastectomy. Again, you have to talk with your provider because one size doesn't fit all. We have to make sure we are treating you as a whole, as a patient. At the time of either surgery, we always ask our plastic surgeon, Dr. Rob Howard, to be involved if the patient's interested, so he's able to provide the best cosmetic outcome for the patient as well.
Thank you. And I'll have some questions for Dr. Howard next, but one more for you, Dr. Sun. What about breast implants? So if you have breast implants, can you get a mammogram? What should you be thinking about?
Yeah, absolutely. If you have breast implants, you can absolutely get a mammogram. It does not mean you cannot. So obtain screening.
Great. Thank you very much for clarifying that. So before we move on to Dr. Howard, I just want to welcome our newer viewers, anyone that's joined us in the last few minutes who aren't familiar with the topic today. So I just wanted to thank you for tuning in and just remind you that we're talking with breast surgeon Dr. Jennifer Sun about the importance of early detection through mammography and our options if a lump is detected. We talked about that. If you have any additional questions about what a mammogram is, what happens if you receive a positive result, or how often or who should get a mammogram, please, you can ask them again in the questions or watch the replay. We answer those for you. Next, we're going to switch gears and talk to Dr. Howard and talk about breast reconstructive surgery. So if you have any questions about that, please ask those in the comments as well. So Dr. Howard, can you talk about who is a candidate for breast reconstructive surgery?
Sure, Karen. Breast reconstruction, like Dr. Sun said, is highly individualized. There are very few reasons why a woman might not be a candidate for breast reconstruction. So we look at the whole patient, we look at their individual goals, we look at their individual risk factors for surgery and for reconstruction success. Certain medical conditions might increase surgical risk, like heart disease or lung disease, and we can look to manage these, with the team. Some risk factors, we can modify, things like nicotine use or diabetes. We can look to manage. So, for example, I ask women who are smokers to quit smoking before mastectomy or reconstruction. When we're treating cancer, we follow the NCCN guidelines. It's rare, but there are a few aggressive form of cancers where we might want to, delay reconstruction until certain cancer treatments are completed. So again, it's individualized. We look at risks and benefits, and most women, if they desire reconstruction, we can find something to offer.
Thank you. And those factors that you mentioned, like quitting smoking, those are things that should be considered before the procedure, and something that you talk to with your physician, or talk about with your physician, and they'll help you to understand what those factors are.
Yeah, it's nicotine is the issue. So typical nicotine use can cause constriction of the blood vessels. And I was going to talk a little bit about, how the blood vessel and blood supply to the skin of the breast is very important in reconstruction. So it's important that we get patients off nicotine before surgery, if at all possible.
Great, thank you. Can you talk about what's involved in breast reconstruction?
Sure. We've learned in treating breast cancer that it's safe to preserve as much of the tissue surrounding the breast tissue as possible. And that's evolved. So we can preserve the skin of the breast and the muscle, and sometimes we can even preserve the nipple and areola. So breast reconstruction is really replacing the breast tissue that's removed during the mastectomy. We can do it a number of ways. Generally, these fall into two categories. We can use either implants, or we can use the patient's own tissues. Tissues that we use for breast reconstruction can come from the patient's tummy or their back or even their buttock or upper thighs. These are called free flaps or tissue flaps. Sometimes we even use hybrid techniques, which use an implant with the patient's own tissue. But again, it's very individualized for every patient.
Thank you. How much is breast symmetry impacted before undergoing surgery?
Well, we certainly aim to attain symmetry after breast reconstruction, even though, perfect symmetry is rare in nature. Symmetry can be affected by the patient's choice to have one or both breasts treated with mastectomy. Some women elect to have a prophylactic mastectomy, and doing bilateral reconstruction, we can match a reconstructed breast to a reconstructed breast pretty readily. Our ability to match a natural breast with breast reconstruction after a unilateral or just a one-sided mastectomy is, our ability to do that is greatly improved even over the course of my career. There's a bunch of great new techniques, implant technology, for example. One thing it's important to know, especially for those patients that have a unilateral mastectomy or one-sided mastectomy, is that symmetry procedures after mastectomy are all covered by law. The Women's Health and Cancer Act, ensures that, and it's not uncommon to offer a lift or even a breast augmentation on the opposite side to make a natural breast match a reconstruction.
Okay, thank you very much. What about risks and complications? What is associated with this kind of surgery?
Sure. Well, in breast reconstruction, some of the risks, as I mentioned, is based on the blood supply to the skin of the breast and the anatomy. So if you can imagine, much of the blood supply to the skin of the breast is traveling through the breast tissue. So when that breast tissue is removed, the blood supply to the skin of the breast must come from the periphery. The blood supply to the skin of the breast can be threatened right after mastectomy. So if we're using an implant or a tissue expander, we don't want to stretch or stress the skin because we can have problems with skin loss or wound issues. When I talk about risks of the individualized procedure with the patients, some of the things that come up are bleeding or infection. Infection is rare, bleeding is rare, but infection after an implant or a tissue expander reconstruction can require antibiotics or even a hospital admission, and rarely does an infection cause the need to remove an implant or a tissue expander. So with implants, that's one of the risks. But when we talk about tissue reconstruction and moving tissue from another part of the body, we have to reconnect the blood vessels of the tissue we move. We use microsurgery, connect the artery and veins, and we do a lot of things to monitor that new blood supply to the tissue, so we don't have a complication such as a blood clot or something like that. Those are, again, these are all rare complications of breast reconstruction. One of the things we don't talk about much when it comes to complications is breast pain after breast surgery. And it's something that we put a lot of effort into to prevent in the operating room and after surgery. We have a lot of resources to prevent or to treat breast pain after mastectomy as well. So I think that's all I should say probably right now about it.
Okay, thank you very much for that. I follow-up question for you regarding the breast pain. Is there, would you be put on some type of medication, or is it some other type of treatment option, like
Sure,
compress on? What would you recommend?
yeah, we use a term called enhanced recovery after surgery. It's a multimodal approach to managing your breast pain, and we've got a lot of neat tools, such as some long-acting numbing medicine that can really get women through breast surgery, both mastectomy and reconstruction, with a lot less pain than historical treatments. So there's medications to use after surgery, and there's also treatments for the rare women that have chronic pain that we can do, such as peripheral nerve surgery, and a lot of new techniques that we've developed after things such as amputation pain that I learned in the military. So a lot of techniques that we have to bear.
Thank you. What is the typical recovery time after breast reconstructive surgery?
Great question. So when we just think about wound healing and the incisions we make and the scars that are formed, about 4 weeks until those scars are 80% healed, and they're full strength at about 6 weeks after surgery. So no matter which surgery you have, you generally can return to full activity 6 weeks after surgery. But right after surgery, we like our patients to be active. I ask patients to walk the night of surgery usually. You can walk to your heart's content. We ask you don't exercise for about 4 weeks after surgery. And as was mentioned, with pain being better controlled these days, you might need, strong pain medications for the first few days and feel sore for a couple of weeks. There's, like I mentioned, different techniques. The time off from work might be different depending on the technique, but usually it's about 2 to 4 weeks off of work. But again, at 6 weeks, you're full speed ahead.
Great, thank you very much. Question from our viewers for Dr. Sun. Dr. Sun, for the mammogram itself, is it painful when they actually perform the procedure? Can you talk about that?
No, it's not painful at all. It's maybe a little discomfort. There's a little bit of discomfort because they are compressing on your breast tissue, but it should never be painful enough that it prevents you from having a mammogram. That being said, we do have additional techniques and equipment that helps us prevent that pain. So for our viewers who are just logging on, we do have the Smart Curve paddle that conforms to the shape of the breast that evenly distributes that pressure so that it's not as painful as it is or was at some point.
Thank you. Another question for you from our viewers. Does the size of your breast make a difference when you're getting your mammogram?
No, it should not make a difference. It's all done within 10 minutes, and they still do 2 views, and then they reconstruct that to get a 3D view. But we aim to view the entire breast regardless of your breast size.
Okay, thank you very much. Dr. Howard, question for you. Can a patient have reconstructive surgery years after they've had a mastectomy?
Yeah, they sure can. Some women elect not to go through reconstruction and they try something like an external prosthetic or an external silicone prosthesis. And there is no time limit that you have to have reconstruction. Delayed reconstruction can be done at any time.
Thank you. Another question for you, Dr. Howard. If you have, and this might relate to the breast symmetry, if you have question that we had earlier, if you have a mastectomy on one side and you're looking for a reconstruction on that side, do you also work on the non-cancerous breast for that symmetry? Or is it just the breast that had the cancer that you focus on?
Yeah, I was hoping to mention that those symmetry procedures are all covered, and we often can do a lift or a reduction or an augmentation of the opposite breast to match the reconstruction. Sometimes that's easier than trying to modify the reconstructed breast. But yeah, those are all offered and can really help women attain that symmetry, which helps them feel normal after breast reconstruction.
Yep. Thank you for that. Another question for you, Dr. Sun. How soon do you get the results from your mammogram?
If it's a screening mammogram, meaning they're only doing it to screen every year, usually takes about 24 to 48 hours. It depends on the institution that you go to, but here we aim to get results out within 24 hours. If it is a diagnostic mammogram, meaning that they obtain the additional views because you felt something or because they saw something on screening mammogram, then they give you the results right away at the same visit with a radiologist present.
Thank you. Another question for you, Dr. Sun. You mentioned earlier who should get a mammogram, and you mentioned family history. Can you remind our viewers what that was? And can you talk about what about your grandparent? Is that a family history factor, or is it just immediate? I think you mentioned mom, sister. I'll let you speak to that because I don't remember all the requirements.
So there are different calculators that I use. One's called the Tyrer-Cusack, the other is called the Gale model. Essentially what I do when you come in for a visit, I assess your risk for breast cancer, and I look at your family history, your mother, your sister, even your grandparents. But usually what's a red flag to us is if you have an immediate family member who was diagnosed with breast cancer before the age of 50, okay? And that usually causes a red flag and allows us to use this calculator and assesses your risk of having breast cancer within the first 10 years and in your entire life. And if you're greater than 20% based on these calculators, then we recommend additional screening. But yes, we take everything into account, not just your sister, your mother, or your daughters, but also your grandparents and at the age of their diagnosis as well.
Okay. Thank you very much. That is all the questions that I have for you both today. Before we wrap up our broadcast, Dr. Sun, any final comments or key takeaways that you'd like to share with our viewers?
Yeah, absolutely. I would just like to recommend everyone to obtain screening mammograms at the age of 40. It's not as scary, and we can make it definitely very comfortable for you. It's always powerful to know what's going on with your body and to make sure you're getting and following appropriate guidelines. We're always here for you if you have any questions. If you'd like to speak with anyone, we're happy to meet with you.
Thank you very much. Dr. Howard, any final comments or key takeaways for our viewers?
Sure. Yeah. First, I'd like to thank Dr. Jennifer Sun for just being an incredible surgeon and taking such great care of our patients and leading the team here. I want to thank you, Karen, for giving us this opportunity to participate, to really highlight our team during this Breast Cancer Awareness Month. So thank you.
Of course, and thank you both for your time. We really appreciate it. And thank you to our viewers for tuning in and sharing your questions and sharing this broadcast with your friends and family. Obviously, a very important discussion, and we had an informative conversation with you all. We will have the replay available if you missed anything, available on our Facebook page, so you feel free to watch that. If you'd like to schedule an appointment with Dr. Sun or Dr. Howard, you can call 301-260-3292. Or to schedule a mammogram, you can call 301-260-3301. Thanks again. We hope you have a wonderful rest of the day. Happy Breast Cancer Awareness Month and National Mammography Day on Friday. Have a great day, and we'll see you next time.
Thank you.
Thanks, bye.